Okay, hello everyone. Thank you very much for joining today and listening to the presentation. What I'm going to talk you through over the next 20 minutes or so is the results of a survey that Ipsos conducted on behalf of the HSC and the National Cancer Control Programme in relation to awareness and attitudes towards cancer and cancer risks in particular. The presenting these results today is quite exciting, because it's the first of its kind of these survey that has been conducted in Ireland, and it provides an important benchmark and important important comparative study that can be used to compare to similar studies that have been conducted in many other countries throughout the world, particularly the UK, Denmark, Australia, France, and places like that. And the study itself that we've conducted has taken some of the measurements from those other surveys, so we can do direct cross-country comparison and being comparable in that sense. But I suppose one of the key objectives is it gives us a very good, strong baseline information in order to address some of the knowledge gaps that exist, and to develop strategies and to monitor their effectiveness over the next while in addressing this key area. So some background to the survey that we conducted. The survey was undertaken in the earlier part of this year, so between January and May 2022. So the results that we're presenting today are quite fresh in that sense. That is information that was gathered over the earlier part of the year. It's quite a large sample size for a study of this type. So we've almost just shy of 3,000 interviews that were conducted with a representative sample of the adult population of Ireland. The participants for the survey were selected through a random selection process. It was a random digit dialing approach, which I suppose gives us a gold standard approach in terms of ensuring a representative sample of the population. Obviously, best practice was followed throughout the survey process. The ethical approval was received, and then various steps were taken in terms of ensuring informed consent with participants, and also the interviewers who conducted the surveys undergone sensitivity training that was facilitated by the Irish Hospice Foundation. The objectives of the study, and we'll be talking through each of these in terms of over the course of the next few minutes, was to assess, I think, beliefs about cancer generally, knowledge of the early signs and symptoms of cancer, and also then some of the health seeking behaviors amongst those who, putting them in a position if they did spot signs or symptoms of cancer, what are the steps that they would take, and also looking at the barriers that might prevent them from taking the steps that they should be taken. The questionnaire, as I mentioned, took measures from international study, and we also worked with a wider research advisory group, and it was designed in close consultation with various participants. So getting into results of the survey, and one of the first questions that we asked was people's experience with cancer, either themselves or with other people. And I suppose one of the findings here is that it shows the widespread experience that the people have had with cancer, and that so it's showing that 86% of people know someone personally who has had cancer. So showing the extent to which it has affected such a wide proportion of the population, that virtually everyone in the population has been touched in some way by cancer. For most people, it's someone in their, within their family they identify. So 42% identify someone in their immediate family, 41% someone in their wider family. So very close to home for many people in that sense. Through the sample, and of course it being such a large sample, we did of course pick up people who themselves have had cancer. So 6% of our sample overall have had cancer at some point, with 15% of that 6% currently undergoing treatment for cancer. In order to I suppose first look at some of the beliefs around cancer, what we ask people to do is we ask people to spontaneously identify, the first, when we say the word cancer to them, what are the first three things that come to mind when we ask them to think about cancer. So this is asked spontaneously. We didn't present any list to people when they were doing this. And of course, as you'd expect with something like this, some of the immediate connotations are, of course, very negative connotations around cancer. We can see that at the top there. So the top three that came across: fear, almost half of the sample identified cancer as something to be fearful of. A similar proportion death, and a slightly lower proportion saying that it brought to mind the word disease. But outside of that, we can see, as we read down through the list, we can see, some of the things that are reflected throughout the results that I'm sharing with you today, which is some of the, some more positive connotations, that there is, that there is hope, and that there is, we see things like treatment and hope and things like that coming up there. So, even though, cancer initially gives a fear to people, we can see that, that there is some hope around that. And digging into that in a bit more detail, what we asked people is there's 4 statements we read out to people, and we asked them to the extent to which they agreed or disagree with each of the statements. And so digging a bit further into some of the attitudes around cancer. So the 4 statements we asked them, so you can see them on the screen there. So these days, many people with cancer can expect to continue with normal activities and responsibility. Cancer can often be cured. A diagnosis of cancer is a death sentence, and nothing can be done to reduce your risk of cancer. So 2 quite positive statements, and 2 obviously quite negative statements there, which is why we're seeing the different levels. So the expectations you'll see, you'd hope to see many people agree with the 2 statements on the right and disagree with the 2 statements on the left-hand side. And that's what we can see coming out in the main. So we can see some of the, some of the optimism there on the left-hand side, with quite high proportions, either, strongly agreeing or somewhat agreeing that people with cancer can continue with normal activities, that cancer can often be cured. But also then on the right-hand side, we can see then, some maybe more concerning findings coming in. If we look at the 3rd statement from the left-hand side there, a diagnosis of cancer is a death sentence, 25% agree with this statement. So a quarter of the adult population, feels to some extent that a diagnosis of cancer is a death sentence. If we dig into some of the demographics around this, we can see that there are some groups that are more likely to feel this, and particularly jumping out in that regard is the older end of the population. So those aged 65 and over, who are more likely to agree that a diagnosis of cancer is a death sentence, and pretty much a third of over 65s believe that to be the case. Now, universally, that their views of cancer, are not overall negative. That we can see that they are more likely than general to feel that cancer can often be cured. So there's somewhat contradictory views held within that population in terms of attitudes to cancers. Then, of course, in terms of looking at some of the modifiable risk factors, we asked people, again, a further statement, and we asked them the extent to which they agree or disagree that there are things that people can do to reduce their risk of developing cancer. And we can see quite a high proportion. It's very, very encouraging, the high proportion, 90%, who agree at least somewhat that there are things that they can do in terms of developing in terms of reducing the risk of developing cancer. With quite high levels of agreement with this, looking across the population, we can see that's mirrored, and we don't see a huge amount of difference. Again, we can see maybe in terms of age, a slight difference beginning to creep in there with those who are slightly older, slightly less likely to agree, slightly less likely to agree that there are things they can do to reduce their risk of developing cancer. So again, sort of feeding into some of those things around, them being more likely to agree as well that cancer is a death sentence. Moving on then, in terms of some of the risk factors around cancer, And what we asked people here is we asked them 2 questions, and I'm presenting the results of 2 questions at once here. There's quite a lot going on here. So what we presented here, so what we asked here was, the first thing we asked them is, you know, what things do you think could increase a person's chance of developing cancer? So we didn't present them with anything. We just asked them off the top of their head to identify as many things as they could that could increase their chance of developing cancer. And that's the percentages that we're presenting in the dark blue bars there. For the ones that they didn't identify, we then read out those, and we said, we asked them for each of those, do you think this could increase a person's chance of developing cancer? So it gives us spontaneous versus prompted, you know, in terms of recognition of risk factors. Now, we had a whole range of risk factors. I'm only presenting a selection of them here. There's also a mixture of proven risk factors and also some various other things that, you know, that are not necessarily proven risk factors in terms of developing cancer, but we wanted to measure the public's, you know, perception of these. So things like stress and aerosol use, you can see appearing on the list there. So yeah, so some of the key things we see jumping out at us here, we can see, for example, you know, if we look at the dark blue bars, first of all, we can see that smoking and alcohol consumption, so smoking at the very top, alcohol consumption just under halfway down that list there, they're the highest levels of spontaneous recognition of cancer risk factors. So that these are the things that are top of mind for people. But then various other things which are not necessarily top of mind. So things like, for example, unprotected sun exposure, we can see that just over a third spontaneously identified that. But when we presented them with unprotected sun exposure as a potential risk factor, that awareness of that jumped up considerably. So, you know, 94% are aware that unprotected sun exposure is a cancer risk factor. So, you know, it may not be top of mind for people, but they do recognize that. Bit of a difference again, you know, by demographics, and see that younger people more likely to spontaneously identify factors than older people. And also then we can see then looking at, we'll dig into it a bit more detail. We can see, you know, in terms of, you know, whether or not someone's a smoker or a non-smoker, doesn't really make much difference in terms of their likelihood to recognize smoking as a cancer risk factor. Now, digging into this in a bit more detail, we presented a number of statements to people, you know, about the link between smoking and cancer. So, you know, I'm not going to read them all out there. You can see them on the screen, and you know, in terms of some of the perceptions there of the link between smoking and cancer. You know, and overall we can see, you know, so we can see on the first 3 statements there, you know, quite high proportions agree with each statement, and they're, you know, so things like, you know, that the secondhand smoking in terms of it being a cancer risk factor, or a smoker can, you know, a former smoker can get cancer even after they've quit smoking. So, you know, quite strong levels of recognition towards that. You know, when we look at the difference between smokers and non-smokers, it's marginal. You know, there is some difference, but it's not to any degree. You know, there's no sort of substantial difference there. We can see maybe a concerning difference between smokers and non-smokers in terms of secondhand smoking. So we can see that you know, smokers slightly less likely than non-smokers to think that being exposed to other people's smoke can cause cancer. So perhaps a bit of work to be done on that in terms of ensuring that smokers are very aware of that. But you know, the difference is marginal there. Moving on, then we also asked about similar statements in relation to alcohol, and what we can really see coming across, you know, there's very much universal, almost, you know, understanding and recognition of the risks between smoking and cancer. That it's a bit more mixed, and it's a bit more uncertain when it comes to alcohol consumption. And really, where the difference comes about is that you know, that there's perhaps an understanding that there's a link between heavy alcohol consumption and cancer, but maybe when it comes to moderate or light alcohol consumption, that maybe that people may be a little bit more confused or uncertain as to whether that there is a risk factor there, and maybe it's some things around the myth that, you know, there's potential health benefits from light alcohol consumption, and that's perhaps clouding people's view in terms of that. So we can really see that coming across there. So we can see, for example, the third statement from the right-hand side there, drinking a little alcohol is better for your health than not drinking alcohol at all. Almost 40% agree with that statement, that there is some health benefits to be gained from drinking alcohol. And then if we look on the very left-hand side there, drinking alcohol even moderately increases the risk of developing cancer. Again, we can see coming up close to 40% disagree that is the case, that there isn't a link between moderate alcohol consumption and alcohol. Again, we can see some small differences between alcohol consumption, whether or not people consume alcohol and whether or not they don't, and their perceived risk, that drinkers slightly less likely to understand the risks, or to recognize the risks anyway, that exist. We can also see an age gradient there. Older people less likely to perceive a risk from alcohol consumption than younger people perhaps are. And we can also then see a gender gap coming through there, with women more likely than men to perceive a risk, although some of that could be clouded by differences in alcohol consumption between both groups. Moving on then, I suppose, to sun protection, which, from one of the earlier charts, was less spontaneously recognized as a potential risk factor in terms of in terms of cancer. But we prompted people that there was almost universal recognition that unprotected sun exposure is a cancer risk. So we asked people here is the extent to which they take some protection methods during the summer in Ireland. And we can see, when we asked, we presented people with 3 potential methods they could be taking. So wearing long sleeves, hat or sunglasses, wearing sunscreen of at least factor 30, and limiting the time that they spend in the sun. And 95% said they did at least one of those, with majority saying they do all 3 of those things. Now, this is, of course, is reported prevention methods that people take, so to the extent that we have to, we have to consider this, that there is going to be a social desirability bias, we put it, in terms of, how people are reporting back their behaviors in terms of this. So they may do these things sometimes, but maybe the extent to which they do them consistently and all the time is questionable. The other thing that we also asked parents of parents who have said they had children aged under 12, we asked them the extent to which they took some protection methods on behalf of their children. And so 99% of parents of children under 12 said they'd used at least one of the forms of sun protection methods we asked them, and 97% saying that they use sunscreen of at least factor 50 for their children frequently during the summer in Ireland. When it comes on then, and suppose, the next thing, looking at the risk factors and moving on then to look at some of the cancer signs and symptoms, and we asked a similar way to the risk factors. We asked people to spontaneously identify as many symptoms as they could think of, and then we presented them with symptoms and asked them whether or not they thought that they were a potential symptom of cancer. Now, spontaneous recognition of symptoms, of course, is absolutely crucial in terms of early diagnosis of cancer, and people taking steps then to ensure that the things are picked up early. And we can see that the things that people most likely spontaneously recognize, 74% spontaneously recognizing an unexplained lump or bump, 39% a persistent unexplained pain, 28% being tired all the time, and a few around the 30% there as well. Then when we prompted people, we can see the figures, of course, all quite significantly jump up. Looking at spontaneous recognition of some of the early signs and symptoms, we can see that women and those aged 35 to 64 slightly more likely than other groups to spontaneously recognize some of the signs and symptoms when asked. Then in terms of taking steps, well, we asked people then, if you were to notice a physical sign suggestive of cancer, what would you do first? 72% say that the first thing they would do is to discuss it with a doctor. So they would take a step in terms of, in terms of ensuring that early diagnosis. So it's encouraging to that regard that people, recognize they do need to take a step if they do see something, rather than putting it up the long finger and seeing how things perhaps develop. We do see some differences, and particularly by age, we can see it jumping out, quite a bit. We can see that older people more likely to say they discuss it with a doctor first. So you can see over 80% of the 58 population age 55 plus say they would discuss with a doctor first. 63% of the 18 to 24 population say they would discuss it first. Obviously, interaction with medical professionals and GPs and so on is higher amongst the older population than it is amongst the younger population. So perhaps more opportunity for them. The younger population more likely to say they would do things like conduct their own research first before deciding what to do next. And then in terms of recognizing things to do, in terms of the importance of taking these early steps, you can see on the left hand side there, agreements that going to the doctor as quickly as possible after noticing a symptom of cancer increases the chances of survival. Quite high levels of agreement with that. But when it comes, in terms of looking at the treatment, we can see quite a mixed picture. This middle statement there, most cancer treatment is worse than the cancer itself. The majority feel that is the case. So that's a concern there, and that's a potential barrier to people obviously taking the steps if there's a fear of the treatment that might come as a result. And particularly we can see that jumping out quite strongly. Women, 61% agree with that. Those aged over 65, 60% agree with that. So some of those groups that are more likely to take the steps, perhaps more likely to be fearful of the outcomes. So the particular concern perhaps around that. Finally, then, one of the last things we looked at was to identify other potential barriers to attending a GP in response to cancer signs or symptoms. So we presented a whole range of potential barriers to people that might stop them from going to a GP: difficulty getting an appointment, the cost of going to the GP, the embarrassment talking to the GP, not wanting to make a fuss, a whole variety of things. Now we can see that the vast majority don't identify any of these as being potential barriers to going to the GP. But that there are potential. There are groups for which barriers do come up a bit more than they do for other groups, and we can see younger people, for example, more likely to pick out barriers than older people. So we can see even though even though quite low proportions mentioned cost and convenience of appointment times, generally that is higher amongst the under 35 group in particular. So just over 20% of under 35s identify the cost of GP as being a barrier. Only 6% of over 65s feel that is a barrier. So, some work to be done there in terms of recognizing some of the barriers there and helping people to overcome those barriers in terms of seeking help at an earlier stage. So what can we take from the results of the of this survey? And there's a whole variety of things in terms of actions that need to be considered and steps that need to be taken. That there's many encouraging findings. The high levels of awareness of the link between tobacco and cancer, is obviously encouraging. But there are still some steps to be taken there. For example, recognition that the risk for cancer is still there after quitting. Increase perhaps recognition of the link between secondhand smoking and smoking, and cancer for other people amongst smokers is another key thing there. Alcohol, as we can see from the results, there's quite a mixed and confused picture in terms of relationship between alcohol and cancer, and quite a bit of work to be done perhaps in terms of that, and that myth that some alcohol consumption or moderate alcohol consumption is perhaps beneficial to your health, of course, does persist within groups in the population. Spontaneous awareness of some of the cancer warning signs is quite low, even though when prompted awareness is quite high. It's the spontaneous awareness that is key in terms of encouraging people to take steps and recognizing that when some things happen that they need to go and get help or get more information about it and taking and encouraging them to take those steps. So perhaps further work to be done around that. And also then in terms of some of the barriers to cancer treatment, they're low overall, but they're important for you know, that they are there, and they are stronger barriers for some key groups in terms of that, and particularly those younger age groups and those perhaps less confident with health information, that those barriers do exist, particularly around getting appointments and the financial cost of going to a GP, that they are particularly important. So that provides a brief overview of the findings of the research. There's a more detailed written report which is being published alongside this, and I hope you'll all have the opportunity to read in due course. So thanks for your time today, and I hope you get use out of the research findings from this particular survey. Thank you.